Started. Oh, there you go. So I'm Dr. Mike Bevilacqua. I'm a nephrologist over here in Surrey and our medical lead for our kidney clinic committee. And I'm very happy to have you all join us, as well as to have a great session today about medications and kidney disease. So thanks everyone for coming on this wonderful fall afternoon. Although we're all meeting virtual, I think especially this week, and as always, but definitely more so this week, having just had more time to reflect on it, I think it's good for us to all remember where it is that we come from across the province. Myself, I get to come from the traditional territories of the Katzie, Semiahmoo, and Kwantlen peoples, as well as some other Coast Salish communities. And that's where I have the privilege of working and enjoying life. And I think it's a great time for us to all think of the same. So today we have an excellent and always very highly sought after topic. And I see we've got a lot of attendees here today. This one is about medications and kidney disease. Just a few little housekeeping reminders that I want to give people. One is that this is one of a series of talks. If you've been to some of them before, this will sound familiar. If you're new, welcome, and we're happy to have you. These couple of items about all of our library of talks include the past recordings and upcoming ones. So in terms of all of the talks we've had before, if you go onto our website there, BC Renal, you just put that into Google, it'll come up, and you'll see that we have a whole little page there that collects these various sessions in the past. So you'll get recordings from the previous ones. Today's section is actually being recorded as well, in case there's anything you want to hear and watch a second time. That'll be up there in a week or two, so you'll be able to do so. And then there's a little button as well that says subscribe now. If you click on that, you'll get a little notice every time one of these sessions is coming up live. So go ahead and check that out. A few other housekeeping items is that very intentionally, although you can see and hear us, we can't see and hear you. And that's intentional for privacy reasons, since there's questions and things like that. But we still very much want you to ask questions. And the way you can do that is if you click on the one that says Q&A, so that's the one with the two little speech bubbles, not the chat, but the one that says Q&A, and you type your questions in there, what will happen is I'll collect them as we go through, and then when there's a break in the presentation, we'll be able to address those. I say, in a session like this, we try to keep the questions general. And what I mean by that is if it's anything too particular to your own individual medical situation, I'll advise you to go back and talk to your own kidney team about it. But please put your questions in and we'll answer it in a way that's applicable to everybody. So today, again, we have this great session, and we're very fortunate to have Dr. Dan Martinussen presenting. So Dr. Martinussen has been leading most of our pharmacy efforts in BC Renal for years now. I won't say numbers here to spare anybody that, but so he's both a clinical pharmacist and the Island Health Authority. And as you see, he's been chairing our pharmacy services committee in BC Renal and involved in a whole host of special projects related to medication uses in the kidney world. And it really is him that we have to thank for the great environment we have around medications here in BC. And we're going to address a few very topical and important questions that I'm sure all of you have. And so with that, I'm going to turn it over to Dr. Martinussen.
Thank you, Dr. Bevilacqua. Yes, I'm coming to you today as well from the traditional territories of the Songhees, the Algonquin-speaking peoples of the Songhees and Esquimalt nations, and also the WSÁNEĆ peoples, and certainly appreciate and enjoy working and living on South Vancouver Island. I will go ahead and share my screen now. So today's session, as was advertised, is about managing your medications with help from your pharmacist. And a couple of comments, the disclaimer, certainly, it's for informational purposes only. It's not to be intended as a substitute from your own your professional medical advice, and should not be relied on as health or personal advice. And if you have a particular question about your own health, as Dr. Bevilacqua indicated, always seek the guidance of your doctor and other qualified health professionals on your particular question. But we're happy to take general questions and Dr. Bevilacqua will try to try to generalize a question if it's too specific. And don't delay in seeking that advice from something you may have heard in this presentation. So I'd like to just begin by highlighting that
Sorry, Dan.
kidneys really are the
Oh, sorry. Alexis, are the slides showing up for you, or are
Yep.
they?
They're not showing up for me. I think
Yeah.
there was a delay happening.
It might be. And if need be, it may be, Dan, if it's a bandwidth thing, you can always
Okay.
turn your camera off, if that helps.
Yeah, maybe do that.
Yeah, I'll turn
Everyone
my
got to see
camera
Dr.
off.
Martin, who's sitting now. He'll just be a floating voice. Just to make sure the bandwidth works here.
Yeah, try that share again. We did try it earlier and it was working, so we'll just give it one more go.
Okay.
If not, Dan, I'll pop them up if it doesn't work in just a minute.
All right. Can you see the screen now?
No, unfortunately, we've got the same situation. Just give me 30 seconds here, Dan, and I'll pull up the slides. 1 second.
Yeah, maybe do that if you don't mind, Alexis, and then.
Yeah. Just give me 20 seconds here.
Sorry, all. We'll just advance the slides at a different location.
Everyone, just bear with us a moment there.
Just Zoom, keeping us on our toes. Okay.
Exactly. Never a dull moment with Zoom.
Indeed. It is keeping us on our toes. Okay, here we go. Right. Can everyone see that?
Perfect.
Magic.
Great.
Please resume.
Thank you. Next slide, please. And actually the next slide. Okay. So I kind of like to think of the kidneys as a bit of the canary in the coal mine, in which you'll recall that miners used to use canaries in cages to indicate potential harm for them. And next, Alexis. Okay. And the kidneys are sensitive to, low oxygenation, low blood pressure, high blood pressure, dehydration, obesity, certain drugs, and we'll get into that, high blood sugars, reduced blood flow, and smoking. Next. But the kidneys can compensate for these somewhat by next. Increasing oxygenation, raising or lowering blood pressure, regulating blood sugar, increasing blood flow, and compensating for dehydration. So there's the kidneys do assist themselves in the body in sort of helping regulate all these things. Next slide. And so they can do this up to a certain point, but then problems begin to occur. Next. So the causes and risk factors for kidney disease, the red indicate things that we have some control over. Obviously, we can't choose our parents, and we do age, but we can control diabetes and high blood pressure and heart disease and smoking, and we can make a pretty good effort to make sure we don't become dehydrated. Next slide. So in managing your kidney health, next. We'll just scroll through these. So yeah, so as I said, good blood pressure control, good sugar control, taking your medications as prescribed, keeping a medication list, knowing what non-prescription medications are safe for you to take. So if you walk into a pharmacy, can you make a good choice? And then food, obviously. And smoking does affect pretty much every organ in the body, and certainly the kidneys. So smoking as little as possible, or better yet, not at all. Exercise is good. Following the blood work, identifying what keeps your attitude positive, because I think that's also important. Next slide. So you can just scroll through these. So can medication slow kidney decline? What are some uncommon medications used to help the kidneys? How can I keep track of my medication? Should I take my medications when I am sick? We'll talk about that. And are there medications that can harm the kidneys that I should avoid? Next. And if there's some medications that I should avoid, what ones are safe for me to take? Next. So this looks like a little complicated graph, and I'm sorry for that. But we do have information on a number of different medications, but in this example, on a particular type of medication that compared the medication to placebo or no drug. And by taking the medication, the kidney function, which is on the upright or y-axis, is actually slows the decline in kidney function, which if dialysis is seen as sort of the end point, the goal is to delay progression to dialysis, and this medication can delay that for maybe 8 years or so. And in this particular example, somebody who's 62, the dialysis start date might be 79, or instead of 71. So we do try to manage through, blood sugars, blood pressure, and other medications to slow that decline in kidney function. And that's an important thing to either avoid completely or to delay is starting dialysis. Next slide. So there's several self-management strategies. For blood pressure, take your blood pressure medications as prescribed. I think also not listed here, but getting your home blood pressure monitor and measuring your blood pressure at different times of the day, sitting, standing, left arm, right arm, as long as you don't have an arm being saved for fistula use or for dialysis in the future. Talk to dietitian about limiting salt intake. Unfortunately, in North America, we are presented with too much salt in our foods. Get your body moving. And even just exercising can reduce your blood pressure 5 to 10 points. And then getting to a healthy weight. Again, losing as little as 10 pounds can reduce your systolic pressure by 5 or 10 points. And then learning how to manage your stress, which stress during the day can certainly increase your blood pressure. Sometimes it's unavoidable, but learning how to manage it. Next slide. So why so many blood pressure medications? So you may have been prescribed one initially and maybe another one, and before you know it, you're taking 3, 4, or 5 different medications. And each of those medications would come from a different chemical class, as we say, of medications. And we use lower doses of medications from different classes in order to avoid the side effects of a large dose of any one medication, but also by increasing the dose of any one medication, each of these drugs have a plateauing effect. So taking more doesn't lower your blood pressure more, it just gives you more side effects. Most people require at least 2 blood pressure meds to control the blood pressure. So you may think, am I unusual that I take this many? Why can't I just take one? And these are some of the reasons why. And some names that you may resonate with you. Class of drugs called beta blockers. An example would be atenolol or metoprolol. Typically, they end in the OLOL, and they are an older but very useful class of medications. Calcium channel blockers, they typically end in dipene or pene, and they have a different mechanism of action. And we rely pretty heavily on what we call ACE inhibitors, or ACE with the I, or ARBs. And these are things that end in pril or sartan. And diuretics such as furosemide or hydrochlorothiazide or chlorthalidone. And then we reach out for other medications on occasion if we can't get control of the blood pressure, and those might be clonidine, methyl-dopa, and so forth. But I won't go into those. But as far as ACE, ARBs, diuretics, even calcium channel blockers. Anything that reduces blood pressure can protect the kidneys, but the ACE and ARBs are particularly helpful in reducing the protein that might be spilling into the urine with kidney disease. And your doctor will, if you are going to be started on one of those medications, or you're already on the medication, if a dose is increased or a new drug is added, they will monitor your blood work as well as your blood pressure. And another class of medications more recently, we call the SGLT2 inhibitors, and they are becoming or are popular, and they end in ozin, dapagliflozin, etc., canagliflozin. And you may see your EGFR or your serum creatinine on blood work if you monitor it through an app from the government. And it's quite possible there'll be an early apparent decline in kidney function, what we call an EGFR dip. But that is expected, is anticipated, and we know that we will get the benefit of the drug if we do see that early dip. And that is being monitored by your doctor, but certainly talk to your doctor about anything that looks unusual to you or that you're concerned about. Next slide. So blood sugar management, and again, you can scroll through these selects. So this is the self-management strategy number 2. You can certainly help slow the damage being done to the filters of your kidney and prevent further damage to blood vessels in your heart and the rest of your body. So next slide. And these are guideline ideal ranges for fasting glucose 2 hours after you eat. And on the long term, we look at A1C, and it's ideally less than 7. But really, for you and your targets as an individual, again, speak to your doctor about what the goals of therapy are. Next slide. So again, taking your diabetes medications as directed, following the diet recommendations, and make an appointment with a dietitian at a kidney care clinic or at a diabetic education center, which may be available to you for help and guidance. And once again, get your body moving to help burn sugar or use it, and then aim for a healthy waistline as well. Next slide. So there's lots of medications to control blood sugars. Certainly, many people have diabetes and type 2 diabetes, and there's lots of research and products being brought to market. The ones that are typical these days, metformin, and that's useful down to a certain level of kidney function, then we are not able to use as much or as any at all of the metformin. And that has good evidence behind it. And the SGLT2 inhibitors that I mentioned already, and you can see some names there, they will actually help not only control blood sugars, but also help to slow the decline in kidney function and have other benefits in your body as well. And then another group of medications we call DPP4 inhibitors, and these are the gliptins. They also are helpful in controlling blood sugars and avoiding hypoglycemia, and have some other benefits to them. Older medications are the sulfonylureas, glyburide, gliclazide, still useful and quite affordable. And at the top are insulin, and there's many types of insulin. And those are tried and true, and can be tailored quite well to an individual. And in all of this is checking blood sugars as well as checking blood pressure. So doing this at home and letting your team know what your sugars are, and helping them guide your therapy, but also so you become familiar with how these medications and how your food and how your lifestyle is affecting your sugars. So when your physician and team choose these medications, it depends on, the evidence of benefit, the magnitude of benefit, as well as the safety. Um, so those choices are made in that light, and by all means, speak to your physician about other medications you may have heard about or interested in. But that's sort of the summing this up uh, as best we can. Next slide. Now, controlling cholesterol or blood lipids. Um, there's a number of medications out there that end in statin, and so you probably have heard of statins before. And these belong to a group of medications that tend to lower the LDL, or the low density lipoprotein, the bad cholesterol. And it's really part of an overall heart and kidney disease prevention strategy. And much like the diabetes medications and the blood pressure medications, these are not instead of diet modifications. So really incorporating exercise, getting to a goal weight, and diet modifications are core to all of this. And these medications help you achieve what you, in spite of your best efforts, may not be able to achieve. So they're very useful, but they're not an instead of. So you can't necessarily carry on eating as you have been. Next slide. So stopping smoking. I mentioned that smoking affects every organ in the body, but it also can increase your blood pressure, damage your blood vessels, damage the kidney, and it's can also be carcinogenic, not only to the kidneys, but a lot of other organs. And fortunately, we do have a number of medications that are helpful to help stop smoking. And you can talk to your doctor and pharmacist about that. And there's other non-pharmacologic methods that can be tried as well. And fortunately, in BC, we have, I think, the lowest smoking rate in the country. So we still, it is important to see if we can make that even lower, particularly people who are at risk or of kidney disease or have kidney disease. Next slide. Now, alcohol in of itself, it is actually a carcinogen as well, but alcohol can increase your blood pressure, can increase your blood sugars, it can impact the effectiveness of your medications, and it can actually be additive and cause a side effect profile to be greater with your medication. So if a medication, one of the side effects might be sedation, alcohol mixed with it can be a dangerous combination. However, having said all that, we understand life is to live, and alcohol in moderation may be acceptable, but in your particular circumstance, we encourage you to speak to your doctor about what is the right amount for you, particularly if you're struggling with blood sugars, blood pressures, and are on medications that may interact with alcohol. Next slide. This is another self-management strategy, is understanding your blood work results. So when you go to the lab, you can get an automatic copy of your results. You can get it through an app, as I mentioned. Learn about the tests your doctor is ordering and what they mean, and ask questions and prepare to talk about your results when you go to medical appointments. Really, having kidney disease is a journey and an education, and changing your lifestyle to achieve the results that I'm sure you want to achieve. Next slide. So in addition to knowing your lab tests, what they're for, what we're measuring, what the targets are, maintaining an updated medication record is another self-management strategy. So we certainly encourage you to keep a list of your medications, including non-prescription medications, and take this list with you to all healthcare appointments. Make sure that it's up to date, including trips to the hospital. And should you not be able to speak for yourself, for whatever reason, having a medication list on your person will be very helpful. And for you as an individual, knowing the what, when, and also the why you are taking medications is very important and helpful. And if you're not sure that a medicine is kidney friendly, reach out and ask a pharmacist. Most pharmacists are about the most available health professional to you, but certainly if you go to your physician visit, you can check in that then as well if the medication is right for you. Next slide. Here's an example of a medication list, and it has some, emergency contact numbers and other useful information, the pharmacies that you have or the one pharmacy that you have, some vaccination record. But the rest is rather routine, except for that last column, notes, reason for taking. So even just what it means for you. So for my blood pressure, for my blood sugar, for my cholesterol, for my lipids, those sorts of reminders to yourself why the medication. Also, friends, family that you confide in about your medications. It's useful to know that. Next slide. So if you're sick, and by sick we mean you have more than a minor vomiting, diarrhea, fever, sweats, and or shaking. So we would ask you to stop taking the medications listed below and restart them when you're well, sort of 24 to should be 48 hours after eating and drinking normally. And if in doubt, if you should stop them, contact your pharmacist, your nurse, physician, and really, it's about losing, becoming dehydrated or losing volume in your blood vessels in your body when these drugs, which are meant to help your kidneys and help you overall, if you're dehydrated and lost that volume, they can actually become harmful to your kidneys. So taking a little drug holiday from this when you're really not feeling great is a good idea. So these do include the ACE inhibitors. These are the ones ending in pril, the ARBs ending in sartan, the diuretics. We've listed for you there. Metformin, which is again used for diabetes, and we covered that. Another group of drugs we call NSAIDs, ibuprofen, diclofenac, naproxen, ketorolac are examples. And this is important because ibuprofen, naproxen, these are things you can buy without a prescription. You can walk into a pharmacy, so you should know to avoid those. And you may be asked to avoid them generally, but certainly when you're not well. And then the SGLT2 inhibitors, and these are the ones that are the gliflozins listed there. Next slide. And then finally, the sulfonylureas for diabetes, and we list them there. Okay, next slide. And thanks, Alexis. So a lot of this information can be found on the BC Renal website. If you navigate yourself there, if you haven't looked at that website, it's full of information for you to help you with your kidney disease. So about your medication changes, you may not be on many medications now, or you might be, and you've had that journey where medications are added or changed. And as your kidney function changes, so will your medication needs. What you currently take now will not necessarily meet your needs over time, and your healthcare providers will work with you to make sure you get what you need when you need it and in the right dose. So don't dismay if your doses go up. We're just trying to make you as healthy and protect your kidneys as best we can. Next slide, please. So balancing all your medications. So really, we struggle sometimes to maximize the effectiveness of your medication, and we get the best absorption. So we say take it with or without food for that particular medication. And we want to ensure you experience the fewest side effects. Clearly, if you've got a suffering from side effects, to achieve a goal with your kidneys or your blood pressure, there's probably alternatives. And so there may be some flexibility around dosing or timing, maybe some flexibility around choice of medication as well. Next slide. So in reducing side effects, medications have benefits, that's why we use them, but side effects are, I wouldn't say inevitable, but common. And so our job is to minimize those side effects and maximizing the benefits. So if you start a new medication, if a dose is changed and you're just not feeling great, you're suffering through it, it could be that that medication, if you can bear with it for a couple of weeks, those side effects will go away. Or maybe we need to switch it up and titrate the dose more slowly, or try a different medication. So, don't suffer in silence. Next slide. Yeah, don't suffer in silence. Organizing your medication. So it can be a struggle as medications are added in multiple times of a day that you're asked to take them, uh, just to organize your medications. And so this can be medication lists, um, having relatives or significant others remind you, having calendars, something as simple as having a wall calendar where you put a tick mark when you've taken your medications, and if you take them 2 or 3 or 4 times a day, you at the end of the day end up with 2, 3, or 4 ticks on the calendar to know that you've taken the medication. Tablet organizers, and this is the picture of this is a dosette. So this has slots for 4 times a day over 7 days a week, and that is quite useful. You do have to fill these once a week yourself. And finally, if blister packs, when you find that that's all a bit too overwhelming, blister packs are prepared for you by a community pharmacy, and they can be, again, up to 4 times a day taking the medication, and they're all there. You just have to follow along and pop out the blister. And what the tablet organizers and the blister packs do is, if you say, did I take my medications this morning, and you look in the Friday morning slot and it's empty, chances are you did. But if it's still there, chances are you didn't. So you need to take your medication. And if you do forget to take a medication, and it's near your next dose time, typically we don't ask you to double that dose, but just to carry on with the remaining medications for the day. Next slide. So what medications to avoid? So certainly there are herbal medications which uh, have a reasonable amount of evidence that we know that are helpful. But unfortunately, a lot do not have the evidence. And that's not necessarily a bad thing. It's just they haven't been studied for, you know, um, people like me, health professionals, to know how they will benefit you or harm you. So there's a bit of the unknown. And they're not as regulated by the health protection branch in Canada as you would think. Um, and there's a website that we've created for you. It's Herbal CKD, so chronic kidney disease, herbalckd.com. And where there is evidence or guidance, you'll see information there for you. And vitamin preparations, there's really not a need to take high doses of vitamin A and vitamin C. In fact, high doses of vitamin C can actually cause kidney stones. So just a regular multivitamin if you'd like. Next slide. So pain and anti-inflammatory medications, over-the-counter aspirin or ASA should be avoided unless it's been prescribed in a low dose by your cardiologist or for your heart. So that would be like an 81 milligram. But certainly check in with your doctor to see if you have been taking that, if that's still okay for you to take. Tylenol or acetaminophen is okay, but be aware there's lots of products that have the brand name Tylenol, and they may contain things that are not good for you. So just plain acetaminophen is okay. I've already mentioned ibuprofen, and this is Advil or Motrin. And naproxen is also available without a prescription, Aleve. But otherwise, the prescription NSAIDs, Indocid, naproxen, and others, and also a group that are related, COX-2 inhibitors or Celebrex, should be avoided. And cold and flu preparations, often if they're sort of the advertised as the oral cures your fever, cold, cough, sore throat, etc., the multiple ingredient preparations. They often contain decongestants. And decongestants, when taken by mouth, can increase your blood pressure and constrict your blood vessels. And that's not a desirable thing for blood pressure. You can raise your blood pressure. And also they contain aspirin type meds. And so that's also not necessarily good for your kidneys. So what we suggest is to, if you do need a decongestant, is to get a nasal spray and use that for a short period of time to relieve that symptom. Next slide. So again, this is found on the BC Renal website under Health Info Managing My Care, medication, conditions, and treatment. So this brochure is non-prescription medications and your kidneys. So it's good to check with your doctor or pharmacist before taking any medication, as I've mentioned, but this handout gives you some guidance in terms of what we consider to be safe, some that can be used with caution, and some that should be avoided. Next slide. And it's organized in this way. So okay to take for, so if you have, you need an antacid or you need a cold and flu medication, and then don't take, and you don't take it because, so there's some products that are recommended and some products to avoid and why we'd like you to avoid them. So that's a useful resource. Next slide. So again, all of these are on the BC Renal website. It's as I mentioned, a good resource for you. And next slide. And that's it. Happy to entertain any questions.
Great, and thanks, Dr. Martinussen. So far, no questions have come through, although a great attendance. We've got many people on right now through the whole time here. So please, as a reminder, if you have any questions, go ahead and put them in the little Q&A box there. I'll maybe just start with one while people are thinking about that. You'd mentioned previously that concept of the sick day medication, and you showed the list there. You know, people should stop those if they're feeling unwell. Maybe I missed it. I don't think you went into detail though about when might they start again, or how do people decide, okay, is it time now to pick up these medications again?
Yeah, so generally we say 1 to 2 days after they start feeling well, or they're taking fluid and eating well, that they can start back up. So we certainly want to be careful during the period of time when they're still maybe not have as, they don't have as much, they're still may still be dehydrated, etc. So.
Yeah, perfect. And when in doubt, you just go ahead and check your kidney team, as Dr. Martin said a few times. Oh, sorry, go on.
Oh, and I believe there is a brochure on the BC Renal website about sick days and what to do during the sick days.
Yeah, perfect. Okay, there a couple other questions are coming through about some specific over-the-counter medications, things like muscle relaxants and sleep aids. I'm just double checking because that document you shared, which I love, I think it's one of our underutilized ones that is just so super valuable with the green light and red light for over-the-counter medications. I don't recall if those are on there. I'll just pull them up. I will defer people there, but yeah, I don't know if you recall, there was one about over the counter sleep aids specifically.
Right. So, as with any sleep aid, obviously alcohol is a concern, or just other prescription medications that may interact. But in and of itself, it would be safe to take for kidney disease, but just double check to see that it isn't interacting. And generally, they are used for a short period of time. I see another one about muscle relaxants, and if they work for you, they they're safe in terms of the kidney, but those should only be taken under the advice of your physician, because they can also affect your brain in terms of how you function. So you have to be careful. I see one about CBD, and we certainly I didn't discuss about marijuana or cannabis, and we do have a resource on the website about cannabis as well, and I encourage you to look at that. Now, if you're taking CBD oil for pain or for other reasons, the evidence for CBD and cannabis is not as strong as we'd like it to be, but I think the evidence will emerge. Some people take cannabis recreationally as well as, for reasons to help sleep and so forth. Let your team know cannabis is okay for the kidney, but again, with alcohol, with driving, those sorts of things can be problematic. So, and it's really, you have to be careful with the dose for sure.
Yeah, absolutely. And I think that's a good comment for a lot of them, is just, especially something like, CBD that people maybe haven't mentioned, is to just be open with that about your care team, right? And then you can actually have that discussion. And that's the safest way to approach any of these items. The same for a lot of these questions about various herbal remedies and things like that. It's not that we're discouraging people. We just want to know so that we can make sure it's all done in a safe manner. Okay, I'm going through a few more. One, maybe I'll just take, there was a question about other medications when people are sick, and this was specifically around things like transplant medications. So definitely keep taking those. And really that list that Dr. Martnussen showed is almost the exception to the rule of the ones that you don't want to be taking when you're sick, but your other treatments, especially around things like transplant, you don't want to be interrupting. I'm scrolling through a few other ones here. This is a good question, actually. There was a comment at the beginning when we were talking about some of the medications, the SGLT2 inhibitors, and there's this dip in GFR. The question is, does that dip come back over time, or if not, why is it that this is still a beneficial item? Oh, did we lose Dr. Martnussen? If not, I'll take that one then. I think maybe the connection cut out there. So the way that this is still protective for your kidney over the long run is these medications slow down the loss of kidney function over time. So it's not that dip comes back up, but the way to think about it is as the years and time goes on, since most kidney conditions will actually be progressive, the kidney function will go down over time, it slows down the rate that happens at. I always discuss this with my patients. I tell them to think about like making an investment. You pay up front, so there's a little bit of a drop in your kidney function right when you start, but then the benefit is over the long run, where as the years go on, actually you end up in a much better place than you would have with your kidney function than had you not started that medication. So it's not that dip comes back up, it's by slowing down the loss of function as time goes on. That's where the benefit comes. It's a very, very good question.
Can you hear me now?
Ah, yes, you're back. Yeah, there you go. See, I took a question for you while you were technical difficulties.
Yeah, no, I was just, I would have said exactly the same thing. So thanks for taking over.
Perfect. Oh, sorry, go ahead, Dr. Martnussen.
Where does the medication Kerendia fall into? So that's another newer medication that will also help delay the progression of kidney disease, and we are still looking for more evidence of benefit, but it certainly looks like it will be useful. I see, is melatonin okay occasionally? Yes, but be careful of the dose. it is only meant for occasional use. Some people find it helpful for sleep, and everything's in the dose. So if you suddenly start taking 10 or 15 milligrams and you haven't before, you probably will be sleeping for quite some time and feel groggy. So start out with 3 or 5 milligrams.
Perfect. I want to maybe bring the comment, one of them came up about things like ARBs, that somebody had to stop that because they were told, their kidney function was going down. Earlier on, Dr. Martinussen, you were mentioning that those are one of our preferred medications, actually. So maybe if we could just explain that a little bit more of how we might say this is our preferred medication, but yet someone was told that they have to stop this later on when the kidney function is low.
Right. Or, they may have come into a clinic and they're fairly sick and they're told to stop taking it. So, yes, that can happen. And the intent generally is that when you are feeling better, that is restarted maybe at a lower dose, and we try again titrating it up. But it could be that the benefit diminishes as kidney function goes down significantly, but we do try to continue with it as long as possible to get that benefit. So again, just a caution, when you are sick or admitted to the hospital, we may switch things up and stop it for a period of time.
Yeah, it's a really good point. And it's a tricky one to wrap your head around. So I'm glad that this question came up, because then people are left with the idea of, we were giving a medication that was harmful for the kidneys, but that's absolutely not the case. And Dr. Martinussen just kind of alluded to, there was recently a study that was done where it showed that actually keeping somebody on one of these medications, basically right up until their kidneys don't work anymore, until they're at the point that they need dialysis or a transplant, actually still has benefit. So the way I like to phrase it is, with some kidney diseases, sometimes the kidneys get worse despite medications we're using, but actually, it may have gotten there a whole lot sooner had you not been on these protective medications. There are some individual situations where it might not be the right medication. So that's why these individual decision-making is always super important, because there are some people who do have a reaction to that. But as a general rule, that's why we use these medications. It's worth addressing, because all those things on that sick day list, sometimes people are left with the impression, the same with metformin's a classic example of, why was my kidney doctor giving me a medication that's bad for my kidney? That's not the case. We just have to be careful when people's kidney function is lower. It's a very good question. I'm glad it came up.
I see that there's one that says, are there medications that affect creatinine levels? I think the bigger question is, are there medications that can harm the kidney? And certainly there are, and I've covered a couple of those, but certainly some of the injectable medications that we might use in the hospital, we have to be quite careful with those. And so please, when you come into the hospital or go to a healthcare provider, say, I have kidney disease, my kidney function is, or please know my kidney function is, just so that they're aware. And sometimes, in a busy practice, that I hope is not overlooked, but I'd hate for it to be overlooked. So we need to avoid those other medications. And certainly we talked about some that you could buy without a prescription that could harm your kidneys, and generally should avoid. So leave it at that.
Perfect. We'll do a couple more. There's great questions coming through. One, so there's a specific formulation I'm not sure of, and this is why we actually say, for any supplement, bring it into your team, because there are just so many hundreds of different ones out there that, we don't all know every brand name offhand. So actually bring in the bottle or a picture of the ingredients if it's something you want to take. But maybe I'll make it a general question around magnesium, because it's definitely one that, people will use commonly. I think even just general population's aware, if you've got muscle cramping or things like that, magnesium might be a good idea. But it'll always say on there, if you have kidney issues, you need to talk with your doctor about it. So I don't know, any thoughts there about magnesium, Dan or Dr. Martinussen?
Yeah, the body we do need magnesium, and the body regulates magnesium fairly well. And generally speaking, a good balanced diet should provide you with your magnesium needs. On occasion, people will become low in magnesium, and that will be discovered with your blood work, with your physician, particularly your nephrologist, and we may ask you to take a magnesium supplement. Things to be careful about: if you're taking magnesium orally, magnesium can cause diarrhea. So, if you're taking an antacid that's got aluminum and magnesium in it, the aluminum can be constipating and the magnesium can cause diarrhea. So that's why we put them together. But if you're just taking a magnesium supplement, that's one of the potential side effects. So, so I hope that answers the question.
Yeah, no, exactly. That's usually the limiting thing. And then the other point I always tell my patients, the reason it's listed there is it is one of the ones that technically it's possible to take too much magnesium if your kidney, especially if your kidney function is low. But I think Dr. Martinuson's right, is that the diarrhea will tell you before you get there. But again, always check it with your kidney team. There was a question, maybe I'll take one or two more here about probiotics. That's an interesting one. I'm not sure if there's any specific guidance that you give your patients, Dr. Martinuson.
Yeah, so the research in probiotics, unfortunately, is not definitive, and it's largely around people who've been exposed to really potent, broad antibiotics and restoring their gut flora. In terms of probiotics for kidney disease, I'm not aware of any evidence that they're helpful at all. But if you have been in the hospital and exposed to broad spectrum antibiotics, you may get some guidance about particular probiotics.
Yeah, perfect. Yeah, totally agree. And then maybe the last one that we'll take is just when should we're talking about all these medications for kidneys and for kidney function and things like that. The question is, when do we start them to make the most benefit? And I'd say the general rule here is the earlier the better. Meaning the description I like to use is the kidney's the type of organ that once the damage is done, it's done. It's not like your liver, for example, that heals a lot of damage. So all of these strategies that we talked about today, it's all about trying to get there and prevent more damage from happening. So trying to get on top of all of these things as early as possible is definitely the way to go.
Yeah,
Please.
I agree, and I see a couple of questions about symptoms, and so yes, cholesterol, blood pressure, diabetes. When the problem's identified is the time to start taking those therapies. But in terms of symptoms from kidney disease, it's often called a silent disease, and you may not know that you have kidney disease, but when the kidney function becomes quite low, you might start getting symptoms of kidney disease, and at that time, we would address those symptoms with certain medications. But I agree that as soon as the problem's identified, you should correct it, hopefully through lifestyle modification as well as with medications.
Yeah, perfect. And yeah, there were a couple of last little ones about the a few symptom items. And again, I would say for those specific ones, it's always often tricky to identify, is this from a medication or a different issue going on related to your kidneys or other health issue. So those are the type of ones, definitely bring that back to your team and your kidney team, and they can help sort that out. There were a couple of ones in there about a couple of dietary supplements. I'd say some of those are listed on the Herbal CKD website that Dr. Martinuson referred to earlier. Otherwise, we actually, on that BC Renal website, there are a few other specific resources around specifically some diet items. So with the last minute or two, I just want to bring this up again, just to remind people. It'll actually answer one of the questions. So there was a question about the recordings. So it won't be directly sent out to you, but it will be up on our website, just like it's shown here where it says recorded session. Usually within a couple of weeks, this will be up there. So if you go to the BC Renal website, you'll be able to access this recording over there. Otherwise, with the last minute or two that we have here, I just want to remind people about our next session. So this is one in a series of webinars, and our next upcoming one is a recurring one that we do about kidney transplantation and finding a kidney donor. So it's a great session. This will be later in the month on the 20th. Again, you can go to that little subscribe now link and you'll get the alert. Otherwise, you can put that in your calendar now. And oh, maybe I went one too far. The other item I want to put is what you will get in your email is a little a link to a feedback form, an evaluation form. We've been doing these sessions now for a little while, but we're always definitely want to hear from you about your feedback of what might make these helpful and more useful for you. Otherwise, I just want to thank Dr. Martinussen again for an excellent talk. This one's always one of the most highly attended one. There were lots of people on the line there for it. Lots of great questions. So thank you for a fantastic talk.
Yeah, thank you. And sorry for the technical problems on my end.
We've all learned to love and hate Zoom at the same time over the last couple of years here. Glad we had the backup. So thank you, Dr. Martinussen. And along the technical end, thank you. Do we have Alexis running the IT magic behind the scenes, and Janet who helped set this up, and our whole admin team over at BC Renal as well. And thanks all of you for attending. We hope to see you at our next session later in October.